Botox, onabotulinum toxin A, is approved to treat overactive bladder symptoms such as a strong need to urinate with leakage, urgency, and frequency in adults when another type of medication, anticholinergic, does not work well enough or cannot be taken.
I enjoy doing many different things. I'm in Southern California, so we've got the mountains and the ocean. We live on a boat part-time, so if I want to run off to San Clemente or Catalina Island, or if I want to explore all the nature that's out here in California, I can do it. I'm happiest when I'm on the beach looking at the ocean. My OAB symptoms started a while back. I'd be doing my own thing, and all of a sudden I would leak. At first it was just little leaks, nothing alarming, but I'd have to go to the bathroom, and I didn't know what to do except have a lot of pads and a lot of running to the bathroom. I was wearing multiple pads a day. Basically, if I didn't have pads on me, I was at the mercy of finding a bathroom quickly. When you have OAB, there are a lot of times when you have to quickly find a bathroom, whether you're walking down the street, walking through the airport, walking anywhere. At first, the leaking just happened early in the morning, but then it started happening all the time. There was no calculating when it would hit. It was completely unpredictable. I saw a doctor about 6 months after this started, and he basically said, this happens, it's part of the aging process. And he basically told me to wear pads, wing it, and just do the best you can. My doctor also gave me medication, but I didn't like the side effects. It made me feel nauseous and really dizzy, and I saw no improvement in my OAB symptoms. My doctor recommended the Botox procedure to me, and at first I wasn't sure if it was what I really wanted to do. But I thought, you know what? Nothing else seems to be working, so I felt like it was time to try Botox. Of course, the first time I went in, I was very nervous. I felt kind of leery about it. I wasn't sure if it was the right decision. The actual procedure was quick. It only took about a half hour. I was afraid of the procedure going in, but actually it was less uncomfortable than I thought it would be. I've been treated with Botox for about a year now, and it's been just great for me. I don't have to change pads as often. I don't have to run to the bathroom all the time, and that's a good thing. I've talked to my friends with OAB and basically told them definitely talk to your doctor. If your current medication doesn't work for you, talk to your doctor about another treatment option. I'm really glad I did.
Important safety information. Botox may cause serious side effects that can be life-threatening. Get medical help right away if you have any of these problems anytime, hours to weeks after injection of Botox. Problems swallowing, speaking, or breathing due to weakening of associated muscles can be severe and result in loss of life. You are at the highest risk if these problems are pre-existing before injection. Swallowing problems may last for several months. Spread of toxin effects. The effect of botulinum toxin may affect areas away from the injection site and cause serious symptoms including loss of strength and all-over muscle weakness, double vision, blurred vision, and drooping eyelids, hoarseness or change or loss of voice, trouble saying words clearly, loss of bladder control, trouble breathing, trouble swallowing. Botox may cause loss of strength or general muscle weakness, vision problems, or dizziness within hours to weeks of taking Botox. If this happens, do not drive a car, operate machinery, or do other dangerous activities. Do not take Botox if you are allergic to any of the ingredients in Botox. See medication guide for ingredients. Had an allergic reaction to any other botulinum toxin products such as Myoblock, Rimabotulinum toxin B, Dysport, Abobotulinum toxin A, or Xeomin, Incobotulinum toxin A, have an infection at the planned injection site. Do not take Botox for the treatment of urinary incontinence if you have a urinary tract infection, UTI, or cannot empty your bladder on your own and are not routinely catheterizing. Due to the risk of urinary retention, difficulty fully emptying the bladder, only patients who are willing and able to initiate self-catheterization post-treatment, if required, should be considered for treatment. Patients with diabetes mellitus treated with Botox were more likely to develop urinary retention than non-diabetics. The dose of Botox is not the same as or comparable to another botulinum toxin product. Serious and/or immediate allergic reactions have been reported. They include itching, rash, red itchy welts, wheezing, asthma symptoms, or dizziness or feeling faint. Get medical help right away if you experience symptoms. Further injection of Botox should be discontinued. Tell your doctor about all your muscle or nerve conditions, such as ALS or Lou Gehrig's disease, myasthenia gravis, or Lambert-Eaton syndrome, as you may be at increased risk of serious side effects including difficulty swallowing and difficulty breathing from typical doses of Botox. Tell your doctor about all your medical conditions, including if you have or have had bleeding problems, have plans to have surgery, have symptoms of a urinary tract infection, UTI, and are being treated for urinary incontinence. Symptoms of a urinary tract infection may include pain or burning with urination, frequent urination or fever, have problems emptying your bladder on your own and are being treated for urinary incontinence, are pregnant or plan to become pregnant. It is not known if Botox can harm your unborn baby, are breastfeeding or plan to. It is not known if Botox passes into breast milk. Tell your doctor about all the medicines you take, including prescription and non-prescription medicines, vitamins, and herbal products. Using Botox with certain other medicines may cause serious side effects. Do not start any new medicines until you have told your doctor that you have received Botox in the past. Tell your doctor if you have received any other botulinum toxin product in the last 4 months, have received injections of botulinum toxin such as Myoblock, Dysport, or Xeomin in the past. Tell your doctor exactly which product you received. Have recently received an antibiotic by injection, take muscle relaxants, take an allergy or cold medicine, take a sleep medicine, take aspirin-like products or blood thinners. Other side effects of Botox include dry mouth, discomfort or pain at the injection site, tiredness, headache, neck pain, and eye problems, double vision, blurred vision, decreased eyesight, drooping eyelids, swelling of your eyelids, and dry eyes. In people being treated for urinary incontinence, other side effects include urinary tract infection, painful urination, and/or inability to empty your bladder on your own. If you have difficulty fully emptying your bladder after receiving Botox, you may need to use a disposable self-catheter to empty your bladder up to a few times each day until your bladder is able to start emptying again. For more information, refer to the medication guide or talk with your doctor. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088. Please see Botox full product information, including boxed warning and medication guide.
I tell my friends who have overactive bladder, you need to talk to your doctor about the Botox procedure.